These are photomicrograph images of H&E stained systemic histology slides. The slide of mucous salivary gland is identified by the light hematoxylin stain and the flattened basally located nucleus in the tall columnar cells. Slide of serous salivary gland is identified by the darkly stained serous acinus with a prominent biphasic stain due to the round basally located nucleus and the eosinophilic stained zymogen granules towards the apical part of the pyramidal-shaped cells. Mixed salivary gland has the prominent serous demilunes where the mucous acinus is capped by serous acinus. In the slide of tongue we see the various papillae, filiform, fungiform and circumvallate. Lining epithelium of tongue is stratified squamous parakeratinized. Since filiform papillae have keratin whereas in fungiform and circumvallate keratin is absent. Focused here is the circumvallate papillae with numerous taste buds located in the epithelium along the lateral surface of the papillae. We can also see the von Ebner glands and the skeletal muscles. In all the slides of the gastrointestinal tract the general plan remains the same. Layers seen from luminal surface to the exterior are mucosa, submucosa, muscularis externa and serosa or adventitia. In the slide of esophagus, the lining epithelium of stratified squamous non-keratinized epithelium and the esophageal glands on the submucosa are the characteristic features. This slide could be confused with thin skin, but here we do not see hair follicles. The slide of fundus stomach is often confused, but if we look carefully we can see the columnar epithelium, with an absence of goblet cells, which are seen in the small and large intestine slides. Columnar cells are identified by the elongated nuclei. Here the other feature which stands out are the gastric glands in the lamina propria of mucosa. The round, eosinophilic stained parietal cells, also known as oxyntic cells, in the gastric glands are the characteristic feature of this slide. The pylorus of stomach is characterized by the presence of lightly hematoxylin-stained, mucous glands, the pyloric glands in the lamina propria of mucosa. The gastric pits are long, here, in comparison to the fundus of stomach. The gastric glands are shorter. As we begin with the slides of the small intestine, we see the presence of villi and goblet cells in between the columnar epithelium. The identifying feature in this slide of duodenum is the presence of duodenal glands, the Brunner's glands, in the submucosa. In the slide of jejunum we see the number of goblet cells in the lining epithelium increases. Villi are seen here. There are no glands in submucosa and we do not find any Peyer's patches. In this slide of ileum we see that the number of goblet cells increases, the villi are short. In the mucosa we see the well-defined lymphatic follicles called the Peyer's patches, which is the identifying feature of this slide.
The shape and size of villi differ in the small intestine. In the duodenum, villi are longer compared to ileum. The number of goblet cells in the lining epithelium increases. Ileum has large number of goblet cells, duodenum the least.
In the slide of large intestine we see numerous goblet cells, and an absence of villi. There are intestinal glands present in the mucosa as seen in the small intestine slides too. Villi are absent in appendix. Numerous goblet cells are present. However, the identifying feature is the presence of lymphatic follicles which invade and disrupt the muscularis mucosa and are seen extending into the submucosa. The slide of liver can be identified by the presence of the portal triad, with the hepatic artery, portal vein and bile duct. We also see the central vein, from which the radiating hepatocytes arrange in a hexagonal pattern. Gallbladder has 3 layers, the mucosa, muscularis externa and serosa or adventitia. The lining epithelium is of columnar cells with apical brush border for absorption. The muscularis externa is composed of fibromuscular stroma. Pancreas can be identified by the biphasic stained serous acini and the lightly stained areas of islets of Langerhans. This slide is hard to identify, but the key is to look at the arrangement of cells right beneath the capsule. Here we see the layer of zona glomerulosa, with tall columnar cells, arranged in an inverted U-shaped pattern. The next layer, which is the largest in the cortex, is the zona fasciculata, with polyhedral cells arranged in cords. They have lipid droplets within and appear lightly stained or foamy. Zona reticularis have cells arranged in a reticulate or mesh-like pattern. Few cells have brown pigment, which are the lipofuscin granules. The cleft seen between the pars nervosa and pars distalis is a key to identify this slide. In the pars nervosa we have nerve fibers and P2E sites. While in the pars distalis we see the different type of cells, chromophobes and chromophilies, arranged in clusters. Chromophobes are lightly stained, indifferentiated cells. Chromophilies are the acidophil and basophils. Thyroid follicles seen here are filled with colloid, and we also see the parathyroid gland. It is very important to scan the entire slide rather than focus on a particular area while you try identifying the slide, since you would miss out on the parathyroid, which are a clue for your identification. Similarly for the slide of lung, where you would miss out the intrapulmonary bronchus, if you've only focused on the alveoli. This comes to the end of part 1 of systemic histology slides. In the next video we will continue with the remaining systemic histology slides. Always remember to scan the entire slide if you have a slide in hand rather than just focusing on one area.